Hello, everyone. Welcome to the Glow Podcast. I have a very exciting guest here with me today. I have Tara from Epikast, and we are going to be talking about kind of different trends within the healthcare industry right now, and I'm really excited to get into that. But if you are new here, we are Tailored Marketing, and we partner with organizations in healthcare, longevity, and the wellness space to fuel growth through strategic marketing strategies. So if you're interested, drop a comment below. Tara, thank you so much for coming on. I'm so excited to talk to you today. Would you just kind of go ahead and give a little bit of an introduction to who you are so the listeners know?
Sure, I would be happy to. And first of all, thank you, Taylor, for inviting me. I love being able to learn and talk and share and also just reach a greater audience about so many interesting things happening in life science and healthcare. And given my very long background in healthcare, so I've been in the industry, I almost don't want to admit, more than a quarter of a century. And my background, originally, I thought I wanted to be a doctor and instead took a different path and pursued the business side of healthcare. So I have my master's in public health, always wanted to be committed to the do-gooder side of healthcare, but also where could I really impact the business side in terms of delivery and efficiencies and those areas as well. I am currently with the company Epikast, but my background, I'll tell you really quickly, and then how I got here. My background follows the drug discovery continuum and product development continuum. So I literally started 20 plus years ago at a company called Charles River Laboratories. So that back in the day was like early lab animal medicine, very early preclinical, and then moved into the preclinical space, IND enabling, safety tox, moved into the clinical space, so phases 1, 2, and 3. And then the last 5 to 7 years was more involved in the data technology side, as that's where I saw the industry really blossoming in technology and data. As healthcare is a little behind the technology play, but we're catching up compared to other industries, and we're moving at the speed of light. And then had the privilege of joining Epikast a little under a year ago. And Epikast is really reimagining how we engage healthcare providers and patients in this sort of new world that we are in, especially post-COVID, how we're taking advantage of remote as well as technology. So yes, I have a very long and wide, expansive view of the healthcare industry.
Yeah, no, that's super, super amazing. I feel like, yeah, over 25 years, you definitely gain a lot of experience, wisdom, and knowledge. So that's super, super amazing. And so I guess my first question would be kind of what trends or gaps in pharma talent and engagement motivated you to take action and create kind of a new model?
Right. So it's a good question because healthcare, especially life science. So I'm more on the behind the scenes, right? I work with biopharmaceutical companies, large, mid-sized, small companies that are doing a lot of the development and hopefully having drugs, NDAs, and then bringing them to the market. So gaps in the healthcare space, life science, a lot of it was pharma talent and engagement. We work at Epikast, just really high level. What Epikast does is we provide biopharmaceutical and healthcare organizations with specialized medically trained talent and AI-powered engagement tools to elevate that interaction with healthcare providers, patients, and payers across both US and Europe. So we really want to deliver that high impact communication at a lower operational cost, enabling our clients to scale outreach, accelerate product performance, and enhance patient outcomes. So essentially, we're at the intersection of healthcare expertise and digital efficiency and commercial flexibility. So what does that mean, though, for trends in pharma? One thing that we realized when our founders, who are also Greek, and that plays into our model. I'll get to that in a second. But one of the things we found is that the cost and flexibility of traditional field teams was making it really hard for companies to scale outreach, especially with new launches and mature brands in underserved regions. So companies were forced to choose either reach or cost efficiency. So one of them was the cost and lack of flexibility. And then one of the second reasons that motivated our model, and also what we're seeing, is a disconnect between the data and the field teams. So even though there's all these insights, teams were not using them in real
Yeah.
time to prioritize and tailor conversations with healthcare providers. And then the last thing we continue to see is that talent often lags behind the scientific complexity. So as pipelines with companies become more specialized, and we're seeing a lot of specialization, you're seeing a lot of different types of therapies on the market, different than the typical small molecule. Companies needed teams who could deliver credible and nuanced peer-to-peer dialogues. So that was some of the trends that we saw that motivated us to want to create our company, but also just things that are happening in the industry. And one example is the pharma industry has been outsourcing clinical trials forever, right?
Yeah.
I mean, they're CROs for a reason. And there are also a lot of larger pharma are outsourcing their discovery to smaller companies because large pharma often cannot move as quickly or not as nimble. And smaller companies tend to be much more flexible, adaptable, and innovative. So that model has long been accepted and utilized. So we are applying that type of thinking to more of the late phase, early commercial launch, as well as mature launches. So that's a little bit about some of the gaps in healthcare and life science right now that motivated us.
Yeah, no, that's super, super cool. And I think it's awesome too that you, like, the roots are Greek of Epikast as well, and you're kind of really embracing that. So that's also amazing. And so, could you talk a little bit more to kind of how that has shaped the company's culture and operations?
Absolutely. Great question. We offer, so life science companies are what we're seeing, and what we support is that they're rethinking the whole team structure, talent, and cost efficiency. So basically, they want it all. And in order to survive and as well as thrive in this industry, you have to have it all. So, for example, we're seeing how companies think about building their teams. And that is from both economic pressures, where they need to be more agile and not rely solely on these fixed in-house teams, that many are instead embracing flexible hybrid models that can scale up or scale down depending on market needs. So remember when someone used to have a job and they would be at IBM for 30 years? I mean, that was an asset many years ago. Now that's considered a liability. We don't see that type of concrete inflexibility. There's also much bigger emphasis on accessing specialized talent globally. So there are different approaches and thinking globally that only help make companies even better by incorporating an inclusive and diverse perspective. So companies are recognizing that expertise shouldn't be confined to just one geography, and sourcing talent from places like Greece or other hubs can actually deliver this high quality engagement at a significantly lower cost. And that kind of goes back to our model, which our founders are all from Greece, but educated and lived in the United States for multiple decades. But that connection, that liaison back to Greece has really been a benefit, because we can bring this high specialized, leaner, smarter, adaptable teams that can deliver meaningful engagement without the traditional overhead. And one point I'd also like to make, especially, is the data and the technology.
Yeah.
So we always say we're people first. We are a people first company. We lead with people and connections, communication. Those are absolutely mission critical. However, we use the data and the technology to make our teams even better, so that we have these great synergies. And we're using our special in-house created AI tools to deliver real-time insights that basically prioritize the right healthcare providers, color those messages, improve the ROI all in one, and ensuring compliance and credibility. So compliance is obviously first and foremost, because if you're dealing with different healthcare systems and regions, it's one of our main priorities, is ensuring global compliance and credibility among all of our people. So high standards, better flexibility, and greater impact.
Yeah. No, that's super awesome. And I feel like it works really, really well for you, for the company, and then also for the people too, like, that are taking on these different jobs. So it's like you said, it's people first, but it's really like it works well for everyone in the equation too.
Right. Well, and it's interesting. I think, Taylor, you and I spoke about this before, but Greece has one of the highest amounts of people that have MDs per capita than any other
Yeah.
country. They're in the top 5 of countries where they have very highly educated people, highly credentialed, but there's just a lack of opportunity in this region. The US, we're so lucky. We have these amazing opportunities with all of our research centers and our economy and companies. We have places like Sloan Kettering and MD Anderson and Johns Hopkins. And the place like Greece just has the people, the talent. They just don't have the same level of opportunity there. And a
Yeah.
lot of people want to, it's the best of both worlds because they can take this amazing skill set and work with US companies or in the US space, but still maintain their lifestyle and their culture. So it's really a win-win situation for a lot of our team.
Yeah, no, that's super, super cool. And I remember you saying that during another conversation where you told me that they had the highest MD per, one of the highest in the world MD per capita. And I was like, wow, like I had no idea because you wouldn't really think of it, But like you said too, they don't have really some of the same opportunities that we do have here. So it's putting those opportunities in front of these people that have worked really, really hard to get to where they are, but unfortunately, they just don't have the same opportunities in their geographic location.
Right. And another point that's interesting, and I don't want to speak too much about because I'm not an expert in this area, but I think once they achieve their degree, there's a very different approach to practicing medicine in Greece than in the US. I think there's they get their MD, but then there's a couple-year waiting period before they can even get into a what we would call the equivalent of a residency.
Wow.
So here, yeah. So there's that type of gap also was an opportunity for Epikast because these people can work with our company, gain expertise, gain the
Yeah.
exposure, learn a lot of the skills that would be scalable, applicable. And then we have our US biopharma companies that are really benefiting from these highly educated people. So while they're waiting for their assignments for clinical, they can do a 1 to 2 year assignment. And then if we're working for a biopharma company and they want that person longer, we have a really great pipeline of people. So it's a easy, seamless continuity of supplying talent for our clients.
Yeah, no, that's super, super cool. And it just like has me think too a little bit about like, obviously, you all are focused on the Greek population, but like, what other countries in the world is this similar situation kind of going on, where it's like they have so much talent, but maybe just not as much opportunity, or like the whole process looks a little bit differently too.
Right. Well, I don't think Greece obviously is the only place that this level of outsourcing is happening. I mean, there's a lot of,
Yeah.
if you call different customer service, there's a lot of different types of regions that have lower cost people in roles that are often based in the US. But I think what we bring is that highly educated, credentialed. Many of these people, most of Greece, everyone learns English from the very beginning. So it's second nature. So that is a huge asset, is obviously having the continuity of the language and being able to also understand the cultural nuances. I think, you know, building a high performing team that's distributed across different regions that spread out and time zones, we have to correct for some of those challenges.
Yeah.
So one of the most important things is obviously feeling connected and aligned around the same goals. So finding people to work different time zones, that's easy.
Yeah.
It's wonderful for people, actually. It's that whole work from home or remote or like that COVID mentality that actually changed our approach to we can actually make this look different and make it work better. So
Yeah.
we have a lot of the team that come in at 3 p.m. local Greek time, which they are 7 hours ahead, work till 11 p.m. So we cover 8 a.m. to 8 p.m., which is both East and West Coast US. And the team loves it because it gives them the opportunity, if they have families or if they actually have other clinical jobs or they have other responsibilities, it's really a great way for them to have it all and do it all. And then we benefit because we obviously cover the time zones. But
Yeah.
in addition to logistics, it's also important to prevent the silos. We have these highly specialized, medically trained talent working in different markets, but I think one of the things we really prioritize is strong communication and shared purpose. So when we can go back to the goal and the foundation, the baseline of everything we do, that we have a lot of regular touch points, we have clear expectations, we foster a sense of belonging. Even if the team is remote or hybrid, we have these values and we recruit people who are not just experts, but are collaborative by nature. So we look
Yeah.
for those qualities from the beginning in terms of communication, collaboration, and for example, I was mentioning to you, I just got back from Greece, and they
Yeah.
encourage our US employees to constantly go to Greece and to work with the team and just understand how things go to the office and see how things are going. And it fosters that communication, that shared purpose. And then I'd say the last challenge, though, and this is one I've mentioned before, and this is of the utmost importance, especially in the pharma industry, is consistent quality and compliance at scale.
Yeah.
So what has worked well for us is robust training. So we take our training very seriously and very deeply, and leveraging, again, the technology and data so that everyone's on the same page. So our AI-driven tools ensure that our engagement is not just personalized, but it's aligned with strategy and compliance everywhere we operate. So our team doesn't have to have US experience per se, but we make sure that we have a robust compliance training so that they understand the nuances. So at the end, it's really about local flexibility and global standards. And remembering the best teams are built on trust and clarity and shared commitment.
Yeah. No, that's awesome. And so you've mentioned also that obviously outsourcing commercial roles is kind of a growing trend. And so what opportunities do you think that this is kind of opening up for companies around the world, and then also companies like Epikast as well, and really everyone within kind of the healthcare and industry?
Right. So I've mentioned and we focus a lot on our medical affairs group. So we focus, I think, in medical affairs and commercial. So in the sales, go to market, PDUFA, and even LOE, loss of exclusivity. So those are the spaces we focus on. But we also work in the patient services, patient access space, as well as even patient access and services in the payer space.
Yeah.
So I think what it opens up is blending flexibility and specialization. So
Yeah.
the old model of like a huge fixed in-field team is giving way to a leaner, more adaptable hybrid model. So companies want the ability to scale quickly for launches or new indications, but without carrying that cost around. And one thing that is really a benefit is we can bring on, let's say, for example, I'm just making this up, 10 people, but if we're finding that 10 MSLs is too much, we can always take and repurpose them without changing a contract, without uprooting the team. When you have 10 full-time people at a company, to have to scale that down, there's a lot of reverberations that impact a company if you have to let people go or workforce reductions. And we eliminate that. So we eliminate some of the business burden, but also while keeping things moving and efficient, especially in our industry, whether it's pricing pressures or it's loss of exclusivity or generics coming or even, the government downsizing funding. It's just, there's always pressures, there's always competition. So however we can help. And at the end of the day, Taylor, it's really about getting the therapies to the patients, right? And having some of these specialization and on top of the soft skills is the technical, clinical, medical skills. You're working with healthcare providers to help them sift through this abundance of information. There's a lot of different therapies, there's different indications. What is this adverse event? And all of the information that's coming at healthcare providers, plus they have a huge patient load. Any way we can reduce that burden for them, as well as improve knowledge for the patients for the right therapies, but also the patients to literally access the therapies, navigating their insurance companies, navigating their own compliance to the drug. It's really about the outcomes. So it's patients getting the treatment they need and hopefully improving the outcomes.
Yeah, no, I mean, I think you said it so well, honestly. It's obviously there's a lot of back end things that go into it, but it really is about the outcomes of getting the patient the absolute best care with a very specialized team in place to do that.
Yes. And I think the global talent hubs, you said, there may be other places that are doing this. Obviously, my company is leveraging our Greek history and our Greek roots, but organizations can access these highly qualified, medically trained professionals in other regions at a lower cost, which is
Yeah.
wonderful, without sacrificing quality. So if you can have a lower cost without sacrificing the quality, it's especially relevant to medical affairs teams as they're facing pressures to do more while still building that real scientific credibility. And again, I have to give a plug to our smarter use of data and AI.
Yeah.
And using AI, not just for the sake of AI. Everyone wants to say they use AI, everyone wants to use data, but using it to actually have what I talked to about that purpose, the shared purpose, is which healthcare providers are the best to reach, customizing messaging, measuring impact in real time. It's not about replacing people. I think you'll hear some of this sort of paranoia that a lot of these roles will be replaced by AI. And that's not the case. We don't believe that at all. I forgot there's a quote. I have to maybe come back to you on that. But there's a really big quote about using people that don't use AI will be replaced, but by those people that are using AI. Something like that. I absolutely killed the
Yeah.
quote.
That's okay. That sounds good.
Right. It's about making their work more effective and making sure they're having the right conversations. Time is such a luxury and it's so finite. So how do we have those conversations be the best ones? So it's really balancing the scientific rigor with the commercial agility. So scientific rigor and commercial agility often are not in the same sentence, but we're actually putting those in the same sentence and helping companies deliver meaningful, scalable engagement without losing sight of what makes those relationships credible and human.
Yeah, no, that's amazing. And yeah, I think you said it really well too with AI. I think there is like kind of a scare, that it's going to take over the jobs, but it's really just helping us to perform our jobs better because you still need people, you still want to have these relationships with people. I think if people get taken out of the workplace completely, then it's going to be really, really boring people that are still there, And also, AI's not able to do everything at this point, but it does do a really, really good job, especially of giving us things like data. Because it's very, very factual and logical and like not emotional at all. So AI helps us in so many ways for sure.
Right. Yes, I agree. And, we have to, I'm not an AI expert, but what I do know is using AI responsibly and having committees and teams and reviewing guardrails. And that's something we take seriously as well, is how do we use our medically trained teams with a AI powered precision. So it's the remote model and the AI tools that create and advances in adherence, lower costs, and effortlessly scales.
Yeah, no, for sure. I think that that's great. And so my last question would be, as a global team leader, what challenges have you kind of faced building a high performing team, and what's worked well for you too? Because obviously within any industry you're gonna have challenges, but also you're gonna learn a lot of things along the way. You learn more from your mistakes than from your successes.
Right, of course. Yeah. So I think I touched upon it a little bit, but I'll expand upon it again, is when you have teams that are spread out and you have time zones, different continents, you want to ensure the feeling of connectedness and alignment. So that's one thing, is making sure that everyone understands the why we're doing what we're doing. So that's important, is the shared goals. And you can develop silos. For example, someone in a commercial space role, marketing, sales, go to market strategy versus a medical doctor, a trained PhD. We have somewhat a different approach to our thinking and our level of detail. So different goals, but at the end of the day, it is about a shared vision and shared goal with Epikast. So that's one thing. Also, the communication is really important. Is we have regular team meetings, we have a forum and culture of open communication, and we make sure that all of our leadership is very accessible, and it's sort of a flat chain of command. And then the last one, I think, is ensuring that quality and compliance.
Yeah.
So no matter where you work, having that training and that technology to make everyone on the same page, so that the engagement is customized and personalized, but it's also aligned with our strategy.
Yeah, no, that's awesome. Yeah, I think I mean, all of those were super, super great points, but I think communication and literally like anything that you're doing is always so important. If you're not communicating properly or even just at all, then things can go south really, really quickly.
Correct. Yes. Well, yeah. And it's having that consistent platform of communication that we know we can rely on each week, or that there's spaces that are maybe not scheduled, but communication, compliance, shared purpose. Those are really, I think, the star themes.
Yeah, no, that's awesome. And I would love for you to tell my audience where's the best place to find you, where's the best place to find Epikast if they are interested in learning more. I'll also include it in the show notes with links. But if you want to say it out loud too, that would be great.
Sure, that'd be great. Well, you can always find us online at www.epikast.com. That's epikast.com. You can find us online, and you can always reach out to me directly as well at Tara, Tara, dot Goodman, Goodman, at epikast.com. I'm on LinkedIn as well, and you can message me there. So happy to answer questions or concerns, or even provide additional information and spread the word. So that's how you can find us. And we're based, actually, one thing I'll say is we do have a New York City headquarters. So we have a New York headquarters, and we have obviously our Greek operational hub as well. So we have both of those locations.
That is great. And yeah, like I said, I'll put it all in the show notes too with links so everyone can click as well. Thank you so, so much for coming on. I really, really appreciate it. It was a great conversation. So thank you.
Yes, my pleasure. It was a lot of fun. If I can ever help with anything, please don't hesitate.
Thanks.